A major new healthcare proposal is on the table, and it's promising big things: more choice, more empowerment. But what's really going on under the hood? Well, today, we're not just going to read you the press release. We are conducting a full policy autopsy. Let's scrub in. So this is the official story. It's a simple, powerful idea. Stop giving taxpayer money to big insurance companies and give it directly to you, the people. It's all about consumer choice. Our job today is to put that promise on the operating table and see what its actual consequences are.
Here's how our autopsy is going to go. First, we're going to follow the money, because you always follow the money. Then, we'll slice into what coverage actually means under this plan. After that, we'll identify the winners and losers. And finally, we'll deliver our diagnosis.
Okay, so the plan is being sold as this four-part strategy to finally fix American healthcare. It's pitched as a really clear, straightforward solution to some of the system's absolute biggest headaches. It promises to bring down drug prices, make insurance cheaper, and make everything more transparent. I mean, who wouldn't want that? These are goals pretty much everyone can get behind. But the real question, the one we're here to answer, is how? How does the plan actually get there? And that's where our examination truly begins. All right, first incision. Let's check the financial vital signs. We're looking at an analysis from the Congressional Budget Office, the CBO. They're the nonpartisan scorekeeper for Congress, and they crunched the numbers on a really similar framework. And what they found? Well, it's a massive reshaping of the entire financial landscape. The analysis shows some huge cuts to federal spending. We're talking nearly $900 billion cut from Medicaid, another $300 billion plus from insurance subsidies. So you have to ask, where does all that money go? Well, a huge chunk of it goes to fund tax cuts, mostly for the wealthiest Americans and the insurance companies themselves. Now, when you net it all out, the CBO's analysis projects a federal deficit reduction of $337 billion over 10 years. That's the top-line number you're probably going to hear talked about a lot. But, and this is a huge but, that deficit reduction comes with a very real human cost. The exact same CBO report projects that by 2026, 24 million more people would be uninsured than under the current law. That's the other side of the ledger, and it's absolutely crucial to understand. So here's the key takeaway. This isn't really about saving money in the system. It's about shifting who pays. The financial burden moves from the federal government and gets pushed onto states and individuals. The risk of higher medical bills gets moved squarely onto the shoulders of patients. This is our first major clue that we're looking at a huge philosophical shift. Okay, time for the internal examination. You see, just having an insurance card in your wallet is one thing, but being able to actually afford care when you get sick, that is something else entirely. And this plan, it fundamentally changes the very definition of coverage. This distinction is absolutely critical. A key part of this plan lets individual states waive federal rules about what an insurance plan even has to cover. This gets right to the heart of the difference between being insured and having access to care. Under the previous law, these 10 categories were the absolute floor for most insurance plans. It was a guarantee. Think of it as a basic safety standard. This new framework, though, lets states apply for waivers to change that definition, to basically lower that floor or even remove it entirely. And the potential impact of these waivers is just massive. In states that get them, insurance companies could legally sell plans that don't cover things like maternity care or mental health treatment. For people who need that care, it could mean thousands and thousands of dollars in out-of-pocket costs, or more likely, just not getting the help they need at all. So anytime you have a policy this big, you're gonna have clear winners and, well, those who bear the risk. So let's look at the pathology report. Who comes out ahead here and who gets left behind? On one side, healthier, wealthier people and maybe some small businesses might see more options and lower premiums. But the plan shifts a huge amount of financial risk onto older people, sicker people, and lower income folks, and really onto anyone who might unexpectedly need care for something that is no longer considered essential. So after our whole examination, what is the core diagnosis? What are we really looking at? This isn't just some small tweak to the system we have. No, it is a fundamental change in how America thinks about the very idea of health insurance. What this plan does is move us away from what's called a defined benefit model, where the benefits you get are guaranteed, to a defined contribution model, where only the dollar amount of your subsidy is guaranteed. The risk that healthcare costs will go up, that falls entirely on you. And look, this plan faces some major hurdles to even become a reality. It depends on this incredibly complex chain of events. Congress has to act, then agencies have to write the rules, then states have to make decisions. Every single one of those steps creates enormous uncertainty and the potential for chaos in the market.
So that brings us to the crucial question. Does this thing fundamentally reform healthcare? Or does it just rearrange the pieces on the board, creating a whole new and maybe much riskier game with a different set of winners and losers?
And that, right there, is our final diagnosis. This whole plan is built on a deep tension between individual choice and our collective security. It promises more freedom, more choice, but it leaves us with one final critical question. When a system creates more choice for some, who ultimately ends up paying the price?